like to, in the first presentation, ask for present only opinion regarding of screening programs across the Europe, and also present data what you have and understand you achieved during the cooperation as SMA patients. The presentation will be done by Marie-Christine OUILLADE, which is from France, from SMA from Europe. She's a mother of a girl affected by SMA, but also she's also of FMA telephone board of directors and also board of SMA Europe. Marie-Christine, welcome, and show us why large newborn screening must be provided to us so quickly. Welcome.
So thank you very much to invite me. I have prepared a short presentation regarding a newborn screening in SMA. I don't know how to present the slide. Yes. So it's a great honor to have this opportunity. I'm not a doctor. I'm just a mother of a girl with SMA. And SMA Europe is fighting all over Europe to accelerate some issue for SMA, and especially newborn screening. Just one slide to show you what is SMA Europe. At this time, is 19 different patient organizations all over Europe, and it's registered under the German law. And they are very simple mission. One is to improve the quality of life of people living with SMA. The second one is to bring the effective therapy on patient as soon as possible, and then to encourage optimal standard of care and patient care. So it's very simple. And in the map, you can see all the country that we are covering at this time. Very soon, 2 new countries came. One is Ireland and the other one is Greece. So it slightly improved very at this time. We are organized as all the different organizations. We have a member. Each country or each patient organization has 2 representatives at our national organization, and there's a board. And of course, we have a very high-level scientific advisory board. It's very important for us to have this. It's the way to be sure that everything is okay with our commitment. We are focusing on very different point. Historically, we are focusing more on basic science and understand what is SMA. But now we are close to the pharma, and we work to develop more widely the scientific connaissance of the scientific knowledge at international level. We have done 2 scientific congress, one in 2018 in Krakow in Poland. The second one was this year, early this year in February in Paris, near Paris in Évry. And the next one will be in 2022 in Barcelona. And we also have a very active work with different clinical trial team, and to ensure that clinical trial not only happen in the US, but come also to European countries. We are also participating in the definition of the standard of care, and of course to dissemination of this document. But what is more important today is to accelerate the access to newborn screening, and it's a very, very important talk for us at this time. So we create what we call an alliance, focusing on newborn screening. Why newborn screening in SMA? Just to give you a few figures, in Europe, no country has implemented newborn screening on a regular basis. There's a few pilots in Germany, in Italy, or in Belgium, but no one has performed to implement it at a large scale, at state scale. In the opposite, in the US, 31 countries, 31 states ask it in regular basis. So it's a very, very important. And why newborn screening? There's a pilot. I will give you some data from a pilot in Belgium. This pilot is started in 2017, and whatever the treatment is, if you have babies with 3 copies of SMN2, and if you treat them in the first month, all these babies are working at the age of 2 years old. All. And it's more or less the same for the baby with 2 copies of SMN2. A few ones do not perform to work, but they're all able to stand up. And most of them are able to work at the age of 2 years old. And what we see also is that with Spinraza, we have babies now with the age of 6 years old, and if they are treated pre-symptomatically, they have no symptoms of SMA at 6 years old. So it's a very, very important. And to better understand why we shall treat at the earlier age, is because the way the motor neuron rebuild is very, very, very slow. And as one is destroyed more or less for the entire life. So you never recover a full motor neuron system if you don't treat very early before the symptoms appears. So that's why we create this alliance. What we say is very important to introduce newborn screening, and the objective of the alliance is very high. We intend to have newborn screening available in Europe in all countries by 2025, but it's an objective. And for that, we developed a few tools that will be able at all the European level for all countries, member or not member from SMA Europe, and for patient advocacy group to be able to lobby at national level. As you know, even in the EU, we don't have, it's not a EU relevant topic, the newborn screening is only national relevant topic, so we need to interact very early with the national authority to be able. And what our objective is really to treat at birth, because it can save lives, but not only lives, it saves these children for disability. And it's very, very huge difference if you have a children born without or with very small disability, or a children who has severe disability because it's treated too late. And that's why we create this alliance. As you can see, it's a large alliance. It's focusing, of course, of SMA Europe, but you have also EAMDA and OUILLADE, who are very huge advocate at European level, TreatMD. We have the main pharma of the fields, and we have also some academic, like the University of Groningen for health impact, and also some company who is providing tests to test this baby. So it's a large alliance. This alliance is very new. It was decided just after every Congress to build this, to build this alliance, and it was officially launched in August. At this time, we have a position paper available and a flyer to request newborn screening for your national authority. This flyer is available in 5 different languages, French, German, Italian, and maybe you can find a solution to translate. It's free access. Just ask on the website of SMA, you request a flyer, and we can send you all the details from this flyer. We have also a poster that you can use in your different meeting to apply for newborn screening. But the most important document we are preparing at this time is a white paper. It's a large document to support the organization to go to national authority to request newborn screening. When I say a large paper, it's a very large one. First is cover all the criteria requested, historically requested for newborn screening. Of course, you all know that SMA is an important health problem, but there are different treatment. It's easy to diagnose with a sample of blood, and it's very, very important to identify them. We do some survey around the population, and we know that this testing is acceptable for the population. The natural history of the disease is well understood, and there is an agreement policy of whom to treat, but you will see further that it's not a strong agreement, and it changed month by month regarding new treatment. There were an agreement when only Spinraza was available, but now with Zolgan SMA, many countries like Germany or the US changed their position regarding whom to treat. You can understand that it's difficult to identify whom to treat regarding the type, because we are before symptoms, so we don't know when the first symptoms appear, and so we have to deal with a number of copy of SMN2 copy, and it's a huge discussion, a very strong discussion regarding people regarding babies with 4 copy of SMN2, because this half of these children will probably have symptoms before the age of 3 years old, but one half also can have very late in their life, and even in adult time. So it's a very, very difficult discussion. And also one strong discussion is the cost of a case finding. And at this time, we start to have some data, especially coming from Belgium and from Germany, that say that if you include this test in the general newborn screening testing, the additional cost is around €3 by test. And that means to identify a baby with SMA, the cost is €30,000 the identification. If you imagine that you can change this baby living with a wheelchair to a baby, a walking baby, I think it's not very expensive at this time, but we have to provide more details information. And one other thing is that we cannot do it once. We need to do the testing for each baby born in the country, and it's a very continuous processing time testing. What we also are dealing at this time is sorry, I have a problem. Is that newborn screening process has to be very detailed, with many details how we can do it, and we are preparing paper to ensure that it will be found by the national insurance, but what type of consent, how we can collect blood, how we can analyze the blood, how we can confirm the diagnosis before telling to parent, what we tell to parent, what are the genetic consultation we must say, and then we go to the hospital to see how we can produce and how we have the follow-up of this. And of course, you can imagine there's also a lot of ethical consideration, because it addresses baby very youngly, and this baby seems to be normal for the family, so you have to speak to the family. It's very important. The child must be sure that we can treat it efficiently. And it's very, very important to have all this ethical discussion and to have some answer or at least some question that we can present to national entities. Regarding false positive, there are very, very few false positive. We do not discover any of one because there's a double check. One is first a check, a general testing on SMN1 normally, a double deletion of SMN1, and then as soon as you have a double deletion, you do a different test to confirm the double deletion and to identify the number of copies, so to identify what to treat. What are the pilot trials? At this time, there are more than 500,000 babies tested in Europe. It's not a lot regarding the number of births, but they are mainly in the Spanish, Italian, German, and of course Belgium, where half of the population, half of the birth population is tested today. It's quite interesting. The experience outside Europe is mainly in the US, and also newborn screening is fully generalized in Italy. In Australia. And what are the current challenge? The current challenge is whom to treat. And there are different papers, as I said previously. And now we are going to organize a meeting with the main doctors, one coming from the US with a large experience in the US, and the other are the leader or the chair of a different pilot in Europe. And also, of course, we need to have one ethical professor to accept and to discuss, to launch the discussion. So it's very, very important to have this discussion. This meeting will be held mid-December in 1 week, and it's very important for us to have feedback from this meeting to include in our paper. And what is also very challenging at this time is that in each country you have a different way to apply for newborn screening. It's very, very difficult. The answers are more or less the same, but the questions are worded differently. Some are more focusing about the ethical point of view, some about the techniques, some about the cost. And so it's very important to have this white paper who cover largely all this topic for the time. So this white paper is more or less at the end. We are just waiting to the final meeting in December, and then we will be ready for publication. We hope to publish him on the Rare Disease Day in February. And after that, it will be translated in different national languages to be available in each country. What are we doing after? First, of course, after the first the white paper dissemination, it's very important. But we also work very closely with authorities to implement newborn screening for all rare disease more simply, and to have a sort of international or a European advice from EMA saying this disease is very interesting to be included in the newborn disease panel. It is the case in the US. In the US, the FDA give an advice, a recommendation, saying newborn screening for SMA is important. And as soon as they have this information, they quickly go very fast to this implementation in the different states. So we need to work on this. The second very important point is that we will have a website where you can find, as national organization, all the information needed to apply for newborn screening. And also, we will assess the need of national organization the SMA1 Europe countries, but also other countries who need to have some support to advocate for newborn screening. So we will process and we will support all this information. And what we are also focusing in the future is more or less to have a newborn screening data analysis, is to collect the efficacy of newborn screening regarding the different treatment. What we know today is whatever the treatment is, newborn screening is effective. If you treat this baby with Spinraza or Zolgen SMA or Ridisplan, you have exactly the same efficacy for this baby, whatever the treatment is. It's very important at this time to know this. Of course, in many countries, we are focusing for Zolgen SMA because it's one shot. But if you treat with Spinraza, you have exactly the same efficacy. It's more burden for the family, for the baby, but the efficacy is the same. And more or less that's important. What I have to conclude this talk is to ask you, can you support us in your country? Do you need support? And please contact us if you have any question or something. On our website, on SMA Europe website, you have a dedicated page on newborn screening, and do not hesitate to send message if you need some support. And I think it's the end of my thanks for listening. Do you have any question?
Some delay from my side. Thank you very much for the presentation and overview and your opinion. I think that screening programs are for some countries are something new and thinking that is openly discussed with the patients. I think it's very important also discuss the consequences of providing the newborn screening programs, because as you mentioned, the crucial things is the access to treatment, which is connected because the cost effectiveness depends on the access also to treatment. That's why I think from country to country, what is interesting, how situation can change, depends how wide population is covered by the reimbursement, and one thing, and the second depends what kind of criteria we have for example, the inclusion and exclusion criteria. Yes?
Yes, I fully agree, because in many countries, of course, type 1 have an access to Spinraza, at least in most of the European countries. But in newborn screening, you are unable to say it's a type 1. You are just able to say it has 2 copies or 3 copies or 1 copy. And then it's a huge challenge to go to the national entity and to say, give me the answer for, and it's very, very important. But
that's why I think
one thing very important is just to notice that more or less 80% of the population will have symptoms before the age of 2 years old. So it's just delaying the time you treat, because most of the country treated maybe less than 2 years old, and it's just you treat it 1 year or 2 years in advance, but you will treat them, and this baby will have severe symptoms. If you treat earlier, you will have no symptoms, and it's very it's the year. It's the best. I think it's the best answer you can give to your regulators.
Okay, tell me, what kind of barriers do you find between countries? Is the issue of evidence? Is the issue of the cost effectiveness? Is the issue of the access to drugs, maybe, or the shape of the structure of the system is not prepared for
the first difficulty we have is to have a large scale about testing, blood testing. Because it's a dedicated technique, and you have to implement this technique in your country. More or less, you have some lab who are able to treat a few examples. But for example, in France, we have to deal with 600,000 baby a year. So it's a large number of and the second
Children.
main children, and the second main issue is more to convince about the type for the baby with 4 copy. Shall we treat them or not? What shall we do with this this type of baby? It's a more an ethical point of view, an ethical discussion, and also discussion about identifying someone via genetic, because it's one of the first disease that you do not identify by biological test, but only by a genetic test. And in some countries, it's very tricky to go to this genetic test. And
Yeah,
the
it's
health
true.
economic is not the main issue at this time, because we can
Okay.
show the evidence that it will save a lot of money in the future. It's more focusing on ethic issues, technical issues, and this is not easy, but is it possible to solve them? And we have some way or something to explain people how they can do and what they can propose to the national authorities. And
Yeah.
just I have to say that this slide was prepared with our team in the SMA Newborn Screening Alliance, and especially Robert Pleticha, who helped me very much to do this.
We have some time still, and I have some questions to you, because as you mentioned, the newborn screening is not the issue of cost effectiveness. I think it's true. The issue is only more about the structure and the process, how to deal with the system. But in the same time, as you know, that it's a lot of screening programs already dedicated in some different diseases, congenital defects on some hormones, etc., etc. That's why it's a question. It's really the issue of the structure. It is a small issue regarding the access to laboratories, certifications, or something like that, which is from country to country is different. One thing. And second thing, when I making an analysis between countries, especially CE countries, comparing with the Western Europe, we see different big differences, not only in the issue of the drug access, but also the time to the decision regarding to newborn screenings programs, the how to deal with the pathway of patients in the system, etc. Do you see differences in some kind of clusters, CE countries, Western countries, or maybe others, and
No.
maybe they have some common problems, but there are some differences?
I think in the eastern country it's more easy than in the western part of Europe to have an access of political access to newborn screening. Just to
Okay.
say, at this time we have a positive answer from the regulator in Poland, in Serbia, and that's something that we never had in the western part of Europe. In western part of Europe, you need to establish pilot to show the efficacy, your capability to do the testing, and so on. It takes a very long time. I was quite happy to see that, for example, in Poland, they will start to test in a few months at this time. It's a very, very interesting point. And also, I support the Serbian organization, and we perform very quickly to have an agreement. Now we have to put in place all the structure to ask for the techniques and so on, but we have already the agreement from the political part to access to newborn screening in SMA in Serbia, for example. And that's something we do not have in any Western countries. We have to make a lot of paper evidence and so on. So, and of course, in the opposite, it's very, very difficult to have an access in Romania. We never perform. Even the clinicians are not convinced that newborn screening is a very huge impact, has a very huge impact in the disease. So we have to start very on the basic, and first to convince the clinician to apply for newborn screening. For some
Okay,
clinicians.
but I think this is always the issue, how to introduce something new to the system. Could you tell me also, because one thing which is it's crucial for me when we're thinking about the making the future assessments of long-term outcomes of patients with SMA. Do you think that the connection with the screening programs with registries and the type of treatment, the time duration of treatment of different drugs, and the data that we can compare and to see the outcomes could be useful for thinking of introduction of newborn screening programs? Because you mentioned Poland. Poland has just pilots. We have pilot with experience with new regions of Poland until 2023. It means we still have at least a few
And
years we have equities with health service. It's not
yes,
it's
and
not in the
it's
same
not.
time.
But I think it's crucial to have the two register. One for the people treated symptomatically, and the other one we are intending to put in place very quickly as soon as newborn screening pilots start in the country, to collect data from this baby with newborn screening treatment, to show more in the real life, because at this time most of the data we have is on clinical trial. Nature, for example, for Biogen, is very clear that there's a huge impact on newborn screening treatment. But we need to have some data in real life, and that's why we collect all the data from Germany, from Belgium, to show that in this country, if you compare to the natural history or to the history of people treated with Spinraza, for example, you have a huge impact if you treat with newborn screening. So we have to do this close follow-up with oral registry between baby treated symptomatically because they are out of the scope of newborn screening, or we are not testing it on time, and the baby treated pre-symptomatically. And at this time, all the data are largely in favor of this treatment, very earlier treatment and pre-symptomatically treatment. Just to say, in Belgium, all the babies at 2 years old are working, whatever the number of copies. In Germany,
Mhm.
there's only one with two copies of SMN who is just able to stand and not to work. But all the other ones are able to work. It's huge, and they are able to speak. They have no respiratory effect and no swallowing effect. So it's completely different. And with Zolgan SMA, I have a discussion with Avexis, and Avexis, now is the new Novartis gene therapy. The main difficulty is they had to make report after 1 year, 2 years, 5 years. And what appeared in the US, that the baby treated pre-symptomatically with gene therapy have no effect. And so some parents decide no longer to go to the hospital to go regular update because the baby is well. And they don't feel the need to continue to go to the hospital because there's no symptoms and the baby is well. And so they have to be sure that they can follow up this baby even longer on long term, even if they have no symptoms. That's for me, that's a very huge impact. It's a big problem for Novartis, but from my point of view, it's a big success.
I think that is different successes, and I think the expectation is between countries is discussion. It's we see this. I think that very comparable. Maybe not just the issue of the newborn screening in Poland was the situation with melanoma regarding the access to drugs. And I remember 10 years ago that we had just one drug or two drugs, and the outcomes was very pure. During the 10 years, we have almost all registered drugs because the reimbursement system was more open for RSS's risk-sharing schemes. and the situation changed dramatically, and also outcomes change for especially for survival. I think that that unmet need connected with the survival of patients with SMA is still high, and it's still space for improve. And newborn screening programs is crucial to give the patient chances for that. This is my
Yes.
thinking as an overview of the situation from even that is a difference between countries, but a Belgian example I think confirm that is it's working and it's very visible even that.
Yes, and maybe because I listened this morning, one thing I can say is that whatever the treatment is, the effectiveness is not regarding the treatment, is regarding when you treat the baby, and what are the
Yeah.
disability already established when you treat the baby. And at the same level of disability, Zolgen, SMA, Spinraza, Redisplan are more or less the same effectiveness. It's not due to the treatment, but due to the time you treat, you first start to treat, and
Diagnosis
it's very,
and
very important. Yes.
okay. Thank you very much. I think that we
Thank
have
you.
chances to talk more about this newborn screening programs. Thank you. And